reimbursement, but definitely a critical one when you're looking at delivery systems that need to function, need to move quickly. But you've also hit on the point about the issue of the knowledge creation part that George raised in terms of passing down the knowledge of one delivery system to another, of the experiences, the return on investment, and the databases that have been generated. So that is another part of integration that's needed as we keep that information available to us, no matter what the color of evidence, right, for us. So, Kathy, I'm going to turn to you in the many roles that you've played, and looking again now at the systems level, your personal perspectives beyond the paper. Pretend you never wrote the paper with your colleagues.
Oh, good. This will be the fun one. So, George talked about evidence. Ron talked about the limitations on things actually taking place because of a payment system in place. And Anita talked about the interprofessional education system. And when I think about this from a systems level, and having been a private practitioner and having been an educator and having been a residency director, I think about it as how do you get people, practitioners, to work together? And because the predominant method of profession for dentists is still private practice, and because they rarely actually come into contact with physicians through their private practice, I think we have to approach it in a systems level. So you can all remember or think about professional office buildings, medical office buildings where you have dentists, physicians, all in the same building. Do they work together because they're in the same building? No. So integration is not going to work just because we put them in the same building. Integration is only going to work because because the leadership for the professions actually say this is important that we all work together. So I would personally approach this from the standpoint of trying to get all of the professional organizations to offer their CE to everyone. So if they're offering CE, and I know that this is a money-based thing, it's like what Ron's talking about, it's going to depend on where the money is being spent. But if the AMA, for example, and the ADA, when they're offering CE, that it gives CERP credit to both physicians and dentists and nurses and dental hygienists, then you would start getting people to learn together, and they could even include opportunities for people to talk about what they learned and how they could operationalize this. So I would try and get the leadership to emphasize at the CE level that it is offered to all professions in the same room at the same time.